You're giving the signal.
Welcome to the Insightful Journal. I'm Dr. Lawrence Robinson, a medical doctor with a master's in public health, and we're here to talk about issues on health that will be very insightful to you. Today, we have as our guest Dr. Angela Walker, an expert in the area of maternal and child health, which will be our topic today. I'd like to start off with a quote from Martin Luther King. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We would like to here today on the Insightful Journal start to address these issues of injustice. And one of them that is most important is the issue of infant mortality and maternal and child health. So let's get set and let's get going with the Insightful Journal. Dr. Walker, please
Yes,
give
hello.
a introduction to yourself and tell me a little bit about your background.
Okay. I am a physician, as you know. I actually got certified in internal medicine and also did a master's in public health. I worked at the Centers for Disease Control, and I did a fellowship at Boston University in women's health. On my journey, I had an opportunity to go to the Amazon jungle, and I actually witnessed what women went through there in the jungle. And I'm talking about the indigenous people, the indigenous women in the Amazon. And I was tasked with having to address with them issues related to nutrition, fetal nutrition, nutrition of their children, and their own health after having had babies. So it was very interesting. Now, since then, I have I started working with the state. So I work with the Commonwealth at the moment, but I have a very long history in public health and in disease prevention and health promotion.
Thank you very much, Dr. Walker. Those are some impressive credentials. I didn't know that you actually spent time in the Amazon. That's very interesting. We'll talk about that later. But this issue of maternal and child health and infant mortality is a really very serious problem in our community. Infant mortality actually is a good gauge of how healthy and how well a society is. And unfortunately, here in America, even though we spend the most money on healthcare and we have the most advanced systems, in certain neighborhoods and certain areas, we have very high infant mortality rates. I was a health commissioner, deputy health commissioner for the city under Rendell and Street many years ago, and I had the opportunity to work with the maternal and child health program. We had something called the Healthy Start program here in Philadelphia. And the reason why we had the Healthy Start program is because of the high rate of infant mortality that we had. And we looked at it as the number of deaths per thousand. It's really very high here in Philadelphia. Dr. Walker, can you tell me a little bit about the high infant mortality rate that we have in this city, and what do you think are some of the major causes for this?
Well, one of the reasons we have that is the fact that there is no education or health education in the schools, particularly when it regard to reproductive health. You have young girls, 15, even younger, who are getting pregnant, and sometimes they don't even know that's when they have a belly that's expanding, that that's a pregnancy. So what happens is there's very little decent sex education or reproductive health education starting at an early age. I will tell you that when I went into the jungle, the women there were having their babies at the age of 12, and the community was with them and supported them. That is not something that we necessarily have. We do not have a good support for young women, young ladies, young men who are facing reproductive issues, and that includes young boys becoming men in high school. So we're talking about adolescents. The other thing is that health in general is not something that is a priority for adolescents. So you have children that are smoking, they have poor nutrition, they have a lot of stress. Okay, sometimes they don't sleep for days or hours or days. So in general, their health is not good. As far as what we know about things like smoking and drugs, how they affect alcohol, they affect pregnancies, and so you get high infant mortality rates simply from the exposure to toxins such as alcohol and drugs. But overall, what we have is very low support systems right today for adolescents in their early ages of reproduction. It's left up to sort of like, you have a dartboard and you have some darts and you throw the darts and you think you're going to hit the bullseye, and basically you're missing the bullseye.
I would agree with you. One of the issues that I also addressed when I was the deputy health commissioner for the city was the issue of sexually transmitted diseases. So one of the things that we found out as well is that there were very high rates of chlamydia in these populations as well, and these young people. I mean, and this was actually at the level of middle school. So these weren't even high school. These children were like at schools like Sayre and various schools like that. And certainly, if you have a sexually transmitted disease like chlamydia, which is undiagnosed, that's going to have a negative impact on the pregnancy as well. Dr. Walker?
Exactly.
Yes.
Yes, I agree with the fact. I did want to bring up the sexually transmitted diseases right away, because what happens is we know about the stigma around that. So when you have children or teenagers that are having sex and then they get a sexually transmitted disease, basically they're not going to necessarily tell their parents, or they
Right.
might not even tell their partners. So a lot of stuff gets missed. And what happens is many of these children, these adolescents, show up at an emergency room pregnant and also with a sexually transmitted disease. That is not good for having good prenatal care.
Most
But
certainly.
if you
Most
talk,
certainly it's
yeah,
not. So, one of the issues which I found is really very interesting is that it's a little late when you try to do your intervention once the person is already pregnant. Because, as we
absolutely.
know, the first trimester actually is the main area where the baby is developed. And if you don't have the right vitamins and various things during those first 3 months, you're going to have a low birth weight infant. And the problem is that all of the programs that we have, they don't even start to address the person until after that point. Well, how could they? Many times the person doesn't even know that they're pregnant. So there certainly has to be a paradigm change in terms of how we address this issue of maternal and child health in our community if we're going to really have a impact on it. Dr.
I would
Walker,
like
I
to, I would
know
like,
that you've looked at some of these issues. Can you give me some ideals in terms of what you think some solutions, because that's what we really want to get to.
I think that's important. It's not right to scare people or make people feel upset because of these issues. But I think if we can come up with some real workable solutions, that's better. I actually agree with you about the fact that reproductive health does not start when you have your first pregnancy. So what happens is, I think we need to start earlier in actually educating children, educating adolescents about sexual behavior, sexuality. That's very important. I know there's been pushback from various groups that that should not happen. I know there's pushback from people who are saying, well, that should be in the home. But sometimes that can't happen in the home for various reasons. I think there's a way to address reproductive health and sexuality starting as early, and I'm talking about even before puberty or just around puberty. Now, what I'm hearing is puberty is starting a little bit earlier, but if you start this starting in middle school, it can work. And I know that there have been studies that have been done. There are particular studies that came out of Maryland where teenagers were they had to carry an egg home and take care of it as a part. The boys had to do that, and that was teaching them about, well, if you're going to have sex, you can have a baby and you have to take care of it. There are things out there that we can do, and I still think we should start doing that around the time of puberty.
Yes, I most certainly agree with you. That is one of the strategies. Now, the other issue that we were talking about earlier, which is a really big issue, in fact, it's a political issue and it's coming up everywhere these days, and that's the issue about abortions and the right to a woman's determination in terms of abortion. And of course, this has a lot to do with the issue of mortality, infant mortality. It's the most primal form of infant mortality, and that is the baby is not even allowed to be born if they're going to be aborted. And Philadelphia, when we actually looked at some of the statistics, shows that it has very high rate of term or live abortions. And in fact, some of the statistics that I looked at showed that when you separate populations and look at specific areas of the city, you find that the number of abortions is as much as the number of live births. What do you have to think about this type of an issue?
Well, I have some statistics from the Guttmacher Institute because they track abortions. Um, I wanted to start actually with adolescents, and actually, there is an interesting curve around that issue. And it's not about abortion so much. There's a curve out of the National Vital Statistics that you can get. It actually discusses the issue of abortions and what happens. So, actually, it starts with fetal mortality. What happens in earlier age groups, 15 to 19, you have a rate that's pretty high, and that also compares with women who are 45 and older, which I find very interesting. So what happens is the mortality rate drops between the ages of 20 and 24 to about 34, 35, and then it starts to rise again. So something is going on with the population, but I would say, particularly in adolescence, is the lack of access to reproductive health care. I will
And you're
tell you
talking
that
about spontaneous abortions in this case, correct?
I'm talking about what they track both. They
Okay.
track spontaneous and they non-spontaneous.
Okay.
So getting back to findings, 66%. And here's what happens, particularly in adolescents. Okay, again, a lot of them don't know that they're pregnant. They don't even know what pregnancy is. Okay, and then they find out one day that, oh, you're pregnant. They end up in the emergency room, a pregnancy test is done, they found out they're pregnant. What happens is now they have to either go home to their family, to their parents, and announce this. They may have to hide it. That affects access. It says here that 66% of adolescents reported that someone had driven them to a facility compared to 48 when it comes to abortion care. 66 would do that. 54% of adolescents reported paying out of a pocket for abortion care, an average of $500. And 54% of the adolescents delayed expenses or sold something to help cover for the cost of an abortion compared to 46% for adults. Now, what happens is adolescents don't have access necessary to the money or the means if they want to prevent a pregnancy or to have an abortion. Okay, it says 19% of adolescents who wanted their abortion sooner did not know where to get their abortion compared to 11%, and 57% of the adolescents who wanted their abortion sooner reported not knowing they were pregnant compared to 43% of adults. I think that's pretty stunning, and what that means is that you have adolescents right now today who do not know how to access health care, abortion care, reproductive health. And that's not good for our society. That's not good for this community. And that's why you're seeing a lot of, you see high infant mortality rates besides all the other things that are affecting uh, um, uh, women and adolescents.
I agree with you. One of the things that people try to do is to say that the reason why we have this high rate of infant mortality and is because of socioeconomic conditions. And a lot of people say it's because you're poor and you're uneducated and you don't have money. That's the reason for it. Now, of course, that's a contributes to the fact of the high infant mortality rate, but it's not the only reason. There are many other reasons that are involved, and I am the chairman of the NBLIC, which is the National Black Leadership Initiative on Cancer. And Dr. Ruttman, the professor emeritus at the University of Pennsylvania, did a study looking at the issue of health disparities and what actually caused them. One of the things that we did was we looked at the SEER data, which is related
And
to
let's see.
cancer. And we compared a adjusted population for Washington, D.C. To a population in Haiti. So, as you know, Haiti has the lowest economic and social status of area, and the genetics are pretty much the same. And what we found is that when we looked at issues like cancer rate and infant mortality, that the rates were actually lower in Haiti than they were in Washington D.C. for selected, populations. So that certainly argues against it being just up to socioeconomics. And in addition to that, we compared black males to black females in Washington, D.C. So these were people that lived in the same zip code, they ate the same food, they lived in the same households, they had the same economic status, they were all part of the same family. And what you find is that the rates of cancer and disease are much higher for men than they are for women. So, how do you explain that disparity if it's just due to socioeconomic conditions?
Well, the thing is, we're talking now about cancer and are you talking about Are you talking about mortality or are you talking about morbidity? Because they're two
No,
different
these
things.
were mortality issues. We were actually
All
looking
right.
at death certificates, and I use
Right.
it as
Okay.
an example. And it's true also. I mean, those same factors are true for maternal infant mortality as they are for cancer. We just did our study using it, but the issues in terms of socioeconomics as an argument, those arguments hold
Well,
true for all of the diseases, whether it's cancer or infant mortality.
one of the things about that is that men are less likely to seek out health care, and the other part is the lack of access. And then when there is access, the care is basically not as good as it would be in what I call the majority community. So the care is not good, but the fact is that men are less likely to seek out care. Part of it is because of lack of knowledge. Part of it is fear. Part of it is putting on someone else. I'll give you an example. We talk about STDs, for example. I've taken care of quite a few men and women, and typically when a guy comes to me and he says, "Oh, I have a drip," I have gonorrhea. He blames it on the woman, and then when you ask about his sexuality or what he's been doing, he's had several partners. So the question is, which partner is the one that might have caused this issue? So, and many times they come late. They come when they're really sick.
Right,
You
right.
can
So
see
that's
that with
definitely going to
coronary
have an
artery
impact
disease
on pregnancy
or mortality.
because I've actually experienced it in terms of a infection actually affecting the fallopian tubes. And once
Talking
that
about
happens, then
PID.
it makes it much more difficult for the woman to have a term pregnancy. In fact, there's a specific syndrome for that condition.
You're talking about PID?
Exactly. Pelvic
Pelvic
inflammatory disease.
inflammatory
Yes.
disease. Yeah, the thing about it is that health, we're not teaching hygiene. It used to be, I don't know if you remember, if you were taught hygiene in middle school. I know that in high school we were taught hygiene, but it seems to me that that kind of information is not getting out. The sooner it gets out, the better. And the thing is, this is something that has to happen even as you advance in age. You can't just say you're going to be 20 years old and you're going to have many sexual partners and you're not going to get sick, or the other person's responsible for your health. That's why we tell people, if you want to prevent, or if you prevent yourself from getting HIV, use a condom. Okay. Talk to your partner, use a condom. Those are available. But many times, and I hear it in many sexual partners, that the alternate partner does not want to use a condom. Okay, I'm talking, the male doesn't want to use the condom. And if it's, for example, homosexual sex, he still doesn't want to wear a condom. So that's why we have to start educating the community and not making it look like some kind of a stigma to be educated.
Yeah. Well, I
And
agree
that's the
with you.
problem.
Yes, and we actually looked at that particular issue, particularly with children who were in middle schools. And so uh, part of the things is that it takes a certain level of sophistication to use a condom appropriately. And many times those individuals are not using the condom properly. They'll use the wrong type of lubricant, they won't put it on appropriately, and they'll mishandle it and so forth. And so those children, thinking that they are getting some protection, actually can get themselves in trouble because they're not trained on how to use the prophylactic appropriately.
But that is not an excuse for not getting trained to do it,
I
because
agree. I
if you,
agree.
the
That's an
whole
excuse
thing is,
for
if you're
getting
going to
trained.
have, yeah, I mean, if you're going to have sex, you have to be, if, for example, if you're going to drive a car, don't you have to get a license to drive a car? Don't you have to take a test before you legitimately can drive a car? And sometimes you have to actually get tested many times afterwards because something went wrong. Why are we not doing this with our health?
Well, that's a good question. And I think there certainly needs to be more health education. And I'm not even sure if we can leave that up to the schools or our system. I think that we're actually probably will do better if we get the parents to be more concerned and to spend time in educating their children, and having that as part of the discussion that they have with their children. Many times I
And
find that people are embarrassed or won't talk about it.
and there lies the other issue, because what happens is parents are not necessarily engaged in their children's day-to-day life, unfortunately. I think what we need to do is put more public health messages. I remember when they started talking about how smoking was bad for your health, and I remember that in the 70s. Joe Camel was a bad thing for you, or that kind of thing. Well, why are we not talking more about, if you're going to have sex, what that means? It's going to turn into a baby, or it's going to turn into something else, or whatever. I mean, we should be having those discussions. What is going on?
Yes. Now,
Why
I,
are we
I would
having
like
them?
to just change the topic just a little bit, because there's some other areas which are very important, and these are things which we can do immediately. So, one of the things that we know is that nutrition is very important in terms of having a healthy birth and having a birth that's come to full term and that's not low in its birth weight. And we
Absolutely.
know that even in terms of various types of birth defects, which we have related to nutrition. And as you know, the nutrition is a sore subject in Philadelphia. There are certain B vitamins and certain irons and other things which are really very necessary if you're going to have a normal pregnancy. So, can you tell me a little bit about some of the nutritional strategies that should be implemented to address this issue?
Well, on that topic, I'm not an expert, but I would say that definitely, what we need to do is get sodas out of out of the classroom or in the schools. What we need to do is get better nutrition in the schools. What happens is we need supplementation. Unfortunately, we need that because I think some of the foods that children are consuming today have low nutritional value in terms of vitamins and minerals. So the thing is, for example, pregnancy, you have to have folate,
Yes,
okay,
folic acid. Yes.
and folic acid, and the thing is, our food does not support the absorption of the B vitamins and folate. The other thing is, I was talking about getting sodas out of the school. Sodas are very bad for when you are thinking about having a pregnancy or just health in general. We have an increased rate of diabetes because we have a lot of uh, uh, sodas that have high fructose corn syrup in them, and that is very bad and can lead to obesity and diabetes. Obesity in children, especially when you're looking at, let's say, having a baby, is not a good thing.
Yes.
Okay, so the thing is, we have to look at our diets. I think we have a high calorie, high fat diet that leads to obesity, but it does not lead to good nutrition. So we have to get people to eat their vegetables. That's important. Eat their fruits and vegetables, and eat good meals 2, 3 times a day.
Hmm.
But
What do you
as
think
far as
about
supplement,
a supplement like a vitamin or a vitamin supplement?
there are supplementation, but one of the things I do not believe, and like I said, I'm not an expert in this area. The we don't. The recommendations for supplementation would be for the B vitamins, particularly for folate, thiamine, the B12. But I don't know that people are saying that children need to take a multivitamin every day. Although I would recommend a multivitamin for adolescents and teens because of our poor nutrition.
Yeah, well, I agree with you. I mean, if you're eating the right amount of fresh fruits and vegetables and a balanced diet, you don't have the need for a supplement. But of course, as we know, that is not the case. And this is
And
a
one of the
very
things I want to say about the vitamins before we stop,
okay.
there's two kinds of vitamins. There are fat soluble vitamins, and then there are water soluble vitamins. So the water soluble vitamins, B12, the B's, those vitamins, you can take them. And so a lot of people say, well, we're taking too much, we may be taking too much. The thing is, water soluble vitamins are actually, you don't necessarily, you cannot get poisoned by taking the B vitamins or the water soluble vitamins. On the other hand, with the fat soluble vitamins, there have been recommendations because they are absorbed and they are go into the fat of the
Yes.
body, and they could be a problem. But generally speaking, there's nothing wrong with the B vitamins or the water soluble vitamins.
Yes, I agree with you. So this is a most certainly a very important issue in our society. I would always say that you are what you eat, and certainly it's very important to have a good and a healthy and a balanced diet. And I watch so many of the children going to school with a bag of chips, and a soda. So this is a very interesting topic, and we are certainly going to have to come back and talk about this again. There's so many different areas, and I think we
Yeah,
just
I
touched
agree.
on just a very few of them. So our time is running out, and I would like to thank everyone for watching and hearing this very insightful discussion. Thank you so much.
Thank you. Thank you for inviting me.
Thank you so much for listening to us and the Insightful Journal. We are just starting this particular program, and we hope that you will stay tuned and listen to the various topics. We have some inciting topics that we're going to bring to you, and we're going to be talking about some of the cutting edge things which are affecting our health and our well being. And we want to address this issue of injustice in healthcare. So thank you so much for listening to the Insightful Journal.